I'm a neonatologist. I finished fellowship in 2002, so I've been in practice for 18 years. I spent the first decade after my fellowship in academic medicine at the Children's Hospital of Philadelphia, where I did basic science research into lung development, and I also did clinical care and teaching at the University of Pennsylvania. And then I joined Mednax in 2009 and have worked in Tampa ever since.
Can you tell me about how you got into the field of medicine and if you were inspired by a woman at all?
I have wanted to be a doctor since I was very, very small. I don't have any memory of saying this when I was very little, but I guess I always wanted to be a physician. I had several nurses in my family, and my grandfather's brother was a doctor. And I actually, on one side of my family, there are 9 of the 12 of us that are physicians. I'm the oldest, so we have a big physician family. And my father was a research scientist. He's a plant geneticist, and he was always a big mentor to me. But I didn't have female physicians I knew growing up.
What do you think it means to be a woman in healthcare today?
I think I've always thought of myself as a physician and a neonatologist first. And I think primarily being a woman in healthcare, roles have changed. When I went to medical school in 1989, in my medical school class, there were 20 women out of 110 people, which now seems just silly and ridiculous, but it was a very different time. My male classmates would turn around and say, "Are you girls taking a lighter version of this exam?" It was a really, really different place. I think there's a lot more opportunity now. And I think it's a good time to be a woman in medicine. There's a lot of leadership potential and lots of different paths that your career can take.
And this kind of blends into the previous question, but any more on any of the challenges that you experience as a woman in medicine?
I think sometimes in general, you have to be extra careful to balance all the things in life. I have many male colleagues who are terrific dads, but in the women physicians I've seen still carry a lot of the primary responsibility, no offense to my men physician friends, but primary responsibility for childcare and kind of being the linchpin of their family. So managing that with a career and trying to move your career forward and have a leadership position, those are a lot of balls to juggle in the air. And I'm always very impressed by the women in my group and how they do it. So it can be challenging, but it can be done.
What are some of the positives that come from being a woman in medicine?
I think that the positives are that are the same as they are for men. I mean, I view myself as a physician. I get to wake up every day and help people. And I do go to work and I feel like I do things to help people, and that I can come home at the end of the day and say, hopefully I made a difference, if not for today, but then for someone for the long term. And in the troubling times that our world is facing right now, in a lot of different arenas, I think that's a very good feeling.
What is some advice that you might have for women that are applying to medical school right now or entering the medical field for the first time?
I would say just be prepared for change. I think I come from the era of paper charting and not using computers, to few women in medicine, and a very patriarchal kind of setup, to government not being that involved in healthcare. So I think on every front, it's no longer a matter of just taking good care of the patients and then going home. You have to be prepared for changes in every area, not just keeping up with medical science and clinical changes, but changes in documentation and changes in how medicine is structured. I think you have to, at the beginning, be open for change and not think you have to know exactly what your career is going to be like right at the beginning. At the end of my pediatrics residency, I didn't know what I wanted to do. And I felt like every single other person had a clear path. And I took 3 years off, and I was actually a hospitalist for 2 years at Children's Hospital of Philadelphia and a year for Columbia Presbyterian. And that kind of gave me some time to find my own way. And I would just encourage young women to say, you can find your own way. You don't have to know everything about everything you want to do and have it all planned right out at the beginning. So go easy on yourself.
How do you think women physicians can best support fellow women physicians?
I think to be sensitive of people's individual family planning and life needs. I have 2 adult stepdaughters, so I became a mom later into the game, but I really have learned a lot from all the moms in my group who I've watched have their children while they've been in practice. And so to try to be supportive of people struggling or people being challenged to juggle all those balls in the air. Take the call phone when someone wants to go see their child in the first grade play. Take extra vacation time when somebody is on maternity leave, to try to be supportive of those things, because it comes back to you in kind.
Anything else you want to add or touch on that we might not have covered?
I just would tell young women not to be discouraged if you want to have a leadership position in medicine and want to pursue a career in medicine. A career is a really, really long time. If I look back now, I would have been a lot nicer to or a lot less hard on my 25-year-old self, 24-year-old self, and things evolve over time. So don't be discouraged, and your career can take a lot of different paths, and it is a worthwhile career.